This is the Iowa Online Nurse Residency Program's Resident Spotlight, hosted by Program Coordinator Amanda Bruscher. Today's featured guest is registered nurse Kelsey Martens from Buena Vista Regional Medical Center in Storm Lake, Iowa. Kelsey is a current nurse resident in our September 2024 online cohort.
So we have Kelsey here with us today, and she is a current resident in the nurse residency program in our September 24 cohort. And I'm very excited to talk to her today. So, Kelsey, if you just want to share a little bit about yourself, what facility you work at, kind of your specialty area, that would be great.
All right. Well, I got my nursing 2 years ago. It's hard to believe. And I work in an oncology and infusion center in Storm Lake, Iowa. It's a small hospital. I am married and I have 2 kids. So obviously going to nursing school, it was very busy. And my first 2 years, it's been very busy as well. It's really about it.
Yeah, perfect. Yes, that does sound very busy. So I'm kind of curious, how have you been able to apply the concepts that we cover in our program to your area of work? And also, I know you had a little bit of nursing experience prior to being in the program. So if you want to share a little bit about how that's going.
Mhm. Yeah, so it was a little different setting because most new grads, start out in, a med surg unit. And then I started out in an outpatient setting. So this is all outpatient. It's not inpatient. And I was able to actually do my 6-week preceptorship there. So that helped a lot with my training. Had some nursing experience, but that was more in a nursing home. So I just have to remember to tell myself, I'm a new grad and I'm learning. And, you have good days, you have bad days. So this program has been very helpful with, helping me remind myself of that, just because you hear other people who are going through the same thing. Because sometimes you feel like you're alone. And especially where I'm working, I kind of was, because everybody that I work with is very experienced. So they couldn't really relate to how I was feeling. So this has been very helpful in doing, or, helping me with that. So.
I love that. And one of the questions I like to ask you too is kind of your advice for future residents. And I think kind of that concept of remembering you're not alone that you just mentioned, I think is one I hear often from residents to share with future residents, because it does feel kind of scary. And when you're in a specialty like you are, and
Mm.
I, having worked in infusion and oncology before, I totally understand. I had probably about 2.5 years experience before going in that setting, and I still felt kind of alone when I started. So perfect. I love that. And if you just want to share a little bit about your professional experience focus, so kind of that project we have you do throughout the second half of the program and kind of what you have been focusing on for that.
So I'm focusing on med reconciliation and how important it is. And I started out as a case study, but now that I'm working on it, I almost feel like it's a change project, because I'm trying to get more, like, make it to where everybody's more consistent in med reconciliation. There's things that you have to check before, like we give a lot of chemo, or we give a lot of specialized infusions where there are medications that interact with certain chemos. There are the specialized medications that we do give. You want to make sure they don't have any infection, or they're not on any antibiotics, those types of things. So I'm kind of in between a case study and a change project, and I'm trying to get it to where we're more consistent with med reconciliation.
Yeah, I love that topic. And I think it's important. I feel like in all areas of nursing, medrec is something that is kind of intimidating to people. And you have a patient that shows up with 20 meds on their med list, and you're kind of like, oh, where do I even start? But it is so important, just like you said, with those interactions, and especially when you're working with those specialty meds, having some experience with that. I know kind of how complicated that can be at times. And also, just kind of what do you find has been the most beneficial aspect of the program? So I know you kind of mentioned that feeling of not being alone. Any other takeaways from the program?
Just hearing from other new grads, it's overwhelming and there's so much to learn. I started the program 1 year in already. So most people are starting like right out of nursing school, where I was already working as an RN for a year. So, just hearing from those, that the way I felt that first year is pretty normal. It's reassuring to hear that. And like going back to that advice that you would, I work with a lot of experienced nurses, and they even ask questions like, you're never going to know it all. So, and some of them even come to me and ask me questions. So, I mean, that's just a sign there that, everybody, you're going to learn through your whole nursing career, you will be learning. And so, Yeah, that's another word of advice I would give people as well.
Yeah, I love that. I think I always share in the program one of my favorite parts of nursing is the learning doesn't stop. And if you're getting bored, you're feeling stuck, there's always other opportunities, which I think is just really unique and able to help us grow with that growth mindset we talk about and all those different aspects. So I love that so much. And it sounds like you certainly work in an environment that's supportive. And I'm
Mhm.
glad you really were able to take some takeaways from the program, even with that little experience you had prior to it. I think even sometimes too in our discussions, I still get some takeaways that I bring back to my practice. So I think it's wonderful and I'm glad to hear that it's been beneficial for you.
Yeah.
Anything else you'd like to add today?
Just to remember that the first year is probably the hardest. It gets better, and you will feel more confident. And then just know, yeah, you're always going to learn, and you're never going to know it all. And
Yeah, perfect. Well, thank you so much for being here today, Kelsey, and it's been a joy having you in the program.
thank you.